cancer is divided into stages. First, there's what we call an initiation event, starting with genes. Cancer starts with genes. It might be genes we're born with. It might be genes that are actually changed by a chemical. So those genes become capable of producing cancer cells as they divide into the future. I call that like a seed, that we're planting seeds. That's the first stage of cancer. It can happen very quickly upon consumption of some chemicals or whatever. Then the long stage goes from that point to the point where we actually see we have cancer. That may take years. And that's growing these seeds. It's promoting their growth. In fact, that stage is called promotion. And so the question of whether we do or don't get cancer, it turns out, is primarily related to not the amount of seeds we may plant or the amount of genes we may have that can give rise to cancer. It more relates to how we fertilize that, how we promote those cancer cells to grow over time. That's where nutrition comes into play. Nutrition comes into play back here too, but it's particularly prominent during this phase. And animal protein, as we started doing the research, we could, experimentally, we could turn on the growth of these cells. They go much more rapidly when they were fed animal protein.
More and more, we are all confronted with the reality of cancer. People who have been perfectly healthy, and all of a sudden, we have this tragic diagnosis.
Yes.
And I'm thinking of one that's very real in my life at the moment, where a lady who has been suffering from lymphoma and all kinds of efforts, modern medicine to treat, and doing well, and lo and behold, a downhill slide, and the new diagnosis is she's suffering from leukemia as well.
I would have guessed that.
And so, what's our cancer battle plan?
Well, you know, we set out a cancer battle plan. What Nixon set out one to eliminate or decrease cancer by, 2000? You know, that was the war against cancer. And actually, the risk of getting cancer has increased. Not decreased. We're making some fronts, like on cigarette smoking and lung cancer.
Right.
So we're making some strides there. But we really need to deal with other issues that have been largely ignored. Pollution, for one. Chemical pollution of our environment is a huge thing when it comes to cancer, and probably is at the root of initiating a good share of our cancers and promoting them, are these toxic chemicals. But the way these chemicals get into people is through the food. Right. And as you move up the food chain, from the grasses and grains to the cows, you know, as you move up the food chain, these chemicals get more and more concentrated. And so one very practical step to reducing your chemical load is to eat lower on the food chain, eat the plants. And that will help a lot too. Plus you hear about antioxidants and fiber and low fat. Well, those are all in the plants. So that's another way you deal with preventing cancer. Now I have to just kind of get a little bit off topic here, Dan, and that is that there's a cancer business out there, and it is fueled by early detection. Okay, this is the means. Okay. Now, I'm a doctor. You guys are potentially patients. There are two ways we can establish our relationship. One is you can get sick and you can come to me. You can ask for help. When I give you help, I don't have to have a lot of evidence that it is useful because you ask for the help. Right. But what if you're just having a great time? You're enjoying your wives and your family and your work and everything's wonderful, and I come looking for you. That's called screening. That's mammography, breast self-examination, PSAs. I better be darn sure I'm going to do you more good than harm, don't you think?
That's right.
Well, see, we have all these screening programs out there. They are making healthy people into patients. And the scientific research says their benefits are limited. And, you know, we can go into some details. I'll tell you, I think, pap smears are good. One colon exam is good. Look at your mouth for changes called leukoplakia. Look at the skin for melanoma type issues. Right. But most of the stuff with mammography and breast self-examination and prostate exams and so on, these things are of limited benefit and great harm to people. We should be not putting the money into collecting business by screening, but into changing people's diets and lifestyle like we did with cigarettes. Right. You know, we made a difference. We don't go get chest x-rays on people to prevent lung cancer. We tell them don't smoke. We shouldn't be going and getting mammograms and prostate blood tests on people. We should tell them not to eat that high-fat, high-animal product, highly contaminated diet. But that's not where the money is.
But let me tell you, I just got a broadside from Johns Hopkins, and they are telling us that we ought to watch our diet to prevent prostate cancer.
Yeah, absolutely.
Wow.
And you know, the American College of Physicians, the American Academy of Preventive Medicine, they've all come out and said, don't get PSA tests. You know, so there are some bits of truth that surface there to help the public. But what you need to know as the public is it's up to you. Nobody's going to come and save you with early detection or treatments. These things are not good with few exceptions. You're going to save yourself by your diet and lifestyle. And that's where you need to focus your attention.
Okay. All right. We come back to that same issue again, don't we? Over and over again, is always back to diet with you.
Well, you know, if the pills worked, if the way we were doing things worked, we would look out and we'd see all these healthy people just enjoying great lives. That's not what we see. We see a lot of sick people suffering unnecessarily.
That is true. That is true.